History has come back again. As many people are living in fear and anxiety, the world is seeing and is experiencing what it had experienced in 1918. The 1918 Spanish flu led to deaths of more than 50 million people in the world and infected more than 500 million people globally, which by then was a third of the population of the world. Spanish flu virus was said to have been originated from the animals.
This was not ordinary influenza by another name. People could die in less than 24 hours after the first symptoms. That wasn't common, but it definitely happened. Some of the symptoms were horrific. In fact, it was initially misdiagnosed as everything from cholera, typhoid, dengue, which is referred to as breakbone fever, to give you a sense of those symptoms. People could bleed not only from their nose and mouth, but from their eyes and ears, which is pretty horrific and terrifying.
The coronavirus pandemic has in many ways similarities to the Spanish flu of the 1918, because the flu of that time also grew to a level of pandemic status, covering many countries in the world, just like the coronavirus situation, which is now in over 180 countries. The Spanish flu killed over 50 million people, and over 500 million were affected. And so there are a lot of similarities. In fact, governments that were active, that were having active democracies that time, made efforts that they are borrowing largely from, even to respond to the COVID-19 situation. So that there are a lot of similarities.
This led to the formation of WHO, World Health Organization, in 1948, in a bid to help when health issues and crises comes again. Therefore, Spain became the first country to broadcast the situation, and therefore it is called to date Spanish flu. The similar mistake happened again with COVID-19. The lack of media freedom has led to delayed information to the world concerning COVID-19.
A war against the Chinese virus.
Why do you keep calling this the Chinese virus? There are reports of dozens of incidents of bias against Chinese Americans in this country. Your own aide, Secretary Azar, says he does not use this term. He says ethnicity does not cause the virus. Why do you keep using this? A lot of people say it's racist.
It's not racist at all, no, not at all. It comes from China. That's why. It comes from China.
Kenyans, not having been used to lockdown, today are finding it very hard to stay in their houses the whole day if possible. As the economy goes down, life becomes tough, and every day the world has stopped moving. The most superior governments like the government of US are now threatened, and people are living in fear and anxiety.
Delving on COVID-19 in particular, I must say that this virus is a novel virus, and by its definitional meaning, it means there is no solution to it, because no single government was prepared to respond to it. That's why you see researchers are trying to burn the midnight oil to provide better ways, but governments are also improving based on what modalities are working.
I want to take this opportunity to condole with the family of the person who lost his life, and also to take this opportunity to wish a quick recovery to those who are affected in isolation areas. I want to emphasize the need for using masks, appeal to our border operators to adhere to the measures that we have said. It is in their enlightened self-interest to do so.
The whole world, so to speak, has been so much affected. And that's why, as we speak ostensibly, the whole world is on shutdown because of social distancing as one of the ways of containing the spread. the main thing that's affecting people most, that has affected the crowd gatherings and has stopped business malls and people losing jobs, is because you need to stay away from each other, because I may be well but I'm asymptomatic. I may be carrying the virus but asymptomatic. That means I'm able to pass it to the next person without necessarily showing the signs. So that is in terms of social impact. People are locked up in their houses. People are not able to come together, and so that has a lot of psychosocial impact.
Greetings. Right now, we are not greetings. And walking, we are known to walk close together as a way of showing that we are socially connected. But right now, we are told to walk when we are 1 meter apart. And this has seriously affected us socially. And to those who are believers, there are so many ways that we do to make sure that we are socially connected. I visit my friend. A friend visits me. But right now, it is not being done. So it's affecting us socially. Economically, it has affected almost everyone in the country. To those who are working, to some, they have been sent on compulsory leave, unpaid leave. To some, they are even told, we're going to give you 50% of what you've been earning initially. So it's going to affect us economically. To those in business like myself, since this COVID-19 came to the country, it has seriously affected our business.
In terms of economic impact, I think there's no gainsaying in that regard, because people are working from home. Some people have been furloughed. Some people have been given indefinite leave. Others are not able to pay their bills. People are not able to provide for their families. The focus right now is on beating the pandemic. That means that people who are sick, having pre-existing conditions like cancers and all that, are not being given adequate focus in terms of drugs and doctor appointment and needful interventions. The impact of that is that you're left in pain, and with a fragile healthcare system like in our country, in Kenya, people are really struggling. From time to time, that's why the ones that have been proven to be working, that a country like in the US, like in New York City, they are tending towards flattening the curve. That means as the disease is peaking, they have proven that social distancing is working, keeping at home, washing your hands, maintaining hygiene, and avoiding social contact, proving to be working, because they are reaching the peak of the disease and hence flattening the curve. And we hope that sooner rather than later, the curve will be tending downwards.
For how long will the disease go for?
Simply put, we don't know if this virus is seasonal.
News came in just this morning that South Korea, those who had tested negative, who had been healed, are now even getting a reinfection. But it was not foreseen, because it was foreseen that after some point it would come in waves. Probably that would be the second wave, and we hope that will be the last wave.
That effective Friday, 27th March 2020, there will be a daily curfew from 7 p.m. to 5 a.m. in the morning. And this shall be in effect.
And not putting more much reinforcement on the police to victimize people, beat them up about curfew at night, but also the government should also consider these people are also in search for food.
Is the government must also find a reason why, must tell the people why they must stay at home, in terms of why should I stay at home and my children go hungry. So if the government can work with me so that I don't have to go to a work in the crowded marketplaces, so that my family won't go hungry.
Ndio kwa maana nasema hii kazi, by the way, mungetusaidia kutuongezea masaa. itoke saa 10 na saa moja, hiyo saa 11 ikuja hata at least saa 3 ndio tusaidiwe sisi wa biashara. By the way, tunaumia kama mimi nimeumia sababu biashara yangu tayari imeanguka na ndio nimetegemea nyumba, niko na nyumba ya kurent. Sasa tumeshindwa, tutafanya nini? By the way, tunaomba tu usaidizi sasa na serikali, but sio kusaidiwa tupewe, tusaidiwe kwa masaa tuweze kuasa wenye tulikuwa tunajiaza mbele.
And the infection happens in this way.
This disease, also known as COVID-19, is thought to spread mainly from person to person through respiratory droplets produced when an infected person coughs or sneezes. These droplets can spread to the mouth, nose, or hands of people who are nearby, or possibly be inhaled into the lungs. Take steps to lower your risk of getting sick.
As you wait for the part 2 of this documentary,
let's stay at home. Let's be safe. Let's wear masks. Let's wash our hands so that we defeat coronavirus.